And now you also wanted to talk about, you know, with all the muscles that we have, you know, then you have some massaging that you're doing of some of our muscles too. So, you know, you also have some massage techniques that we talked about a little bit, and you can share that with our viewers. And you also teach these at your class.
Yes, Tina, I do. In the massage techniques for the classes, I do bring a pillow with, and in fact, I've got one here for Tina.
Thank you.
Yeah, we're going to put this right over here.
Okay.
And in the classes, I will demonstrate on myself first, and then I go to each student individually, and I do hands-on to demonstrate the techniques for them.
Okay.
And so, oh, here he
is, yes.
So, Tina, did you want to tell me a little bit about what's going on for your hand?
Sure. I had an injury when I was a young girl. I was climbing a tree, and we were jumping from one tree that was angled like this, and the other tree came out and it had a branch.
Okay.
So we climbed up this tree and then jumped and tried to catch the other branch, and all the other kids could do it. Well, I was too short. So another girl was nice enough, she gave me a push, and this arm caught the branch. This arm came down and hit a rock. The rock hit here, the bone came out of the skin, protruded into the dirt, and jammed back up. Now, I feel really fortunate because after being in the operating room for 6 hours, they told me I'd never have use of my left hand.
Oh, my.
And my mother was a little bit ahead of her time, and she brought a little puppet. And she actually was giving me physical therapy back when that wasn't even, you know, commonplace. And she brought a puppet, and so she made me work with it. And so now I have full use of my left hand, and I do have the scar here on my left hand from where the bone used to come out. And as you can tell, when I do the tendon, that's where the tendon's where they fixed my actual. So I feel very fortunate. So that's my history, and I have a lot of problems. And due to the fact that I have this, I use my right hand way too much.
Sure.
So they also were talking about me having the actual tendonitis through here, so carpal tunnel.
Oh, wow.
Yeah.
Okay.
So I try to use my left hand a little bit more.
Okay.
Yeah.
Well, what I would like to do for Tina, I'd like to demonstrate one of the massage techniques that I teach in the class. Now, one thing for the viewers, this is not a do-at-home kind of thing, because when you come to the class, I will describe all of the safety precautions for using massage techniques, plus I go around and I demonstrate for each person the appropriate degrees of pressure to use. So I'm not encouraging anyone at home to use this technique at home without proper instruction in it, but I did want to show Tina, and I want to show you at home how easily you can use these techniques for your own benefit. So I do encourage you to come to the classes and learn how to use them appropriately. But I just wanted to add that little disclaimer. But now for Tina, what I'm going to use here is a technique called circular friction. And her scar, she has a little bit of what we call adhesion, which means that the tissues are sticking to each other and the underlying tissues. And so even if you want to flex your fingers a couple times, Tina, I'm not sure if you can see this at home, but she's got little pulling here in her hands, and that means that there's some adhesion under those tissues. And with a scar of this degree, as a therapist, I would use a technique called myofascial scar release. However, that is not included in our class, so I'm not going to demonstrate that today. I'm going to demonstrate the circular friction, which we do by gently rubbing the hand around in little circles like this, and you go both directions, and the tissue starts to warm up in there. Can you feel that, Tina?
Feels
yeah.
good.
Yeah, I can even feel the tissue. Oops, and she's got a little restriction down here into her wrist, too. Can you feel that it's a little sticky in there?
Yeah.
Yeah. Now, one thing, the reason we teach this in the class, now Tina's got a scar, and not everyone has a scar like this, but everyone does have troubles in the wrist typically, because there's a band of tissue that looks like a bracelet that surrounds the tendons of the wrists, and it's called the flexor retinaculum. And underneath that little bracelet of connective tissue and the tendons in between, there gets to be a little bit of adhesion, which means stickiness, so that every time you open your fingers and close them, there can be drag or pull in there. And so if you use the circular friction over the flexor retinaculum like this, that can really help to release the adhesions. Can you feel that starting to loosen in there?
Oh, it's amazing.
Yeah.
It is just so amazing.
You do this on all 4 sides. And once again, don't try this at home. Come, let me teach you to do it the right way, because Tina's feeling how much this is. But people always work way too hard. It's very gentle, isn't it, Tina?
Yeah, it is.
Yeah, you can hardly feel it almost.
I know, it's sort of like a small touch like that is, you know, helping me so much. A gentle touch.
Yes. Everything I do in the class is so gentle. People are pretty much astounded that it can be so powerful. See right here too, I'm feeling a lot of restriction in this area. So I'm going to just, can you feel that coming up into the thumb?
Because when it starts to hurt me, I take all my fingers and I push so hard. To try and, you know, I'm like pushing the blood and pretend, you know, thinking, oh, I've got to get the blood flow back in there.
Right, but you see how easy this is. I think you're going to feel a lot of change. I'm just doing a little bit more spot checking here on Tina because she does have so much restriction from this scar. Oh, right there. This is actually not a technique from the class, but I'm doing this special for Tina.
Oh, thanks, because it just makes me feel so much better.
Yeah.
It's amazing when you have a sore toe or sore finger. You know.
Yes. Can you feel how that's loosening up a little bit in there? Yeah.
And I've been working all morning, and so of course I'm a lot tighter than
You're
normal.
a lot more stressed, yeah. So there, see, we're going to release that tendon.
Thank you.
Okay.
Wow.
Oh, you know what, Tina, too? I'm feeling a little restriction right up into here. And so this is another technique we use in the class. First, we use our knuckles very softly. This right here is called your thenar eminence. And it's a mound of tissue right under your thumb, and it's a very common place to have a lot of trouble. And so then you can go right in with your fingertips like that, and you see how that's helping to release that muscle.
Yes.
Right in like that. Okay. So, oh, yep, see, there we go, right there. Can you feel that? How does she know?
Yeah. Wow, it's amazing. It's almost like you have X-ray vision on your fingertips.
You know, it's kind of funny. I call them owie-seeking fingers because they tend to go right to the spot, and there it is right there. You can feel that.
Wow. Oh, and that it runs all the way up there. I could feel that.
Yeah.
Oh my gosh.
That's what they call a trigger point, which means that it's an area of tissue that's a muscle spasm, and it will send its pain somewhere else. And you could feel that pain run right up your wrist, right?
Did,
yeah,
yes.
see, and it's right there. But is it less now? Yeah, see, it's loosening right up for her, and the pain is becoming less. And see, with the techniques in the class, you can learn how to actually address some of this yourself.
Wow.
You know, of course, people, sometimes they like it better when I do it, which is always an option. But it's much more cost effective if you can learn to do a few things for yourself.
Yeah.
So now, Tina, I want you to go ahead and move your fingers in and out and see, can you see how much less dragging you have through the scar?
Oh my gosh.
Do you see that?
It's just not.
Can you see that there's much less puckering?
Because this was just like tight.
It was pulling right straight in.
Like this, I had a thread in there and pulling it.
Yeah,
and now it's
and see,
completely gone.
It's not completely gone, but it is much reduced.
Yes.
It's much reduced. So if we had a little more time to work on that, but can you feel the difference in the hands too, and the freedom in the fingers?
Yeah, it's not as tense.
Yeah, yeah. So, and actually visually I can see the difference in her hand. So that's just to show how quickly and how powerful these techniques can be to create change in the tissues of the body. It really is amazing that we're created that way.
Yeah.
To